Let me introduce my next guest. Dr. Paul Spiegel is the director of the Johns Hopkins Center for Humanitarian Health, and he joins me now live from Baltimore in Maryland. Thank you so much for being with us on the program, Doctor. I want to start off by talking about the closure of the Rafah crossing. It's a vital route for aid, for the injured to seek medical treatment, for people to flee, and that is now all stopped. How profound of an effect is this going to have on the overall humanitarian situation that we're seeing deteriorate by the day?
Obviously, a very profound effect, particularly because there has been insufficient aid being allowed in to Gaza for nearly 7 months now. And so every time they're at such a critical level at this point that any time aid is not allowed to go through, it has a much more significant and really serious health effects compared to if this was just shut, but aid was getting in at a sufficient level previously.
The WHO, as we just heard, has voiced its concern about the situation at the partially functioning hospital, saying that they're going to shut down due to the lack of fuel there. What are you hearing on the situation in hospitals in particular, and what kind of a disaster will we witness if they don't receive that fuel?
So, I mean, hospitals, unfortunately, as we know, have been attacked throughout the situation, and so Rafah actually has has very important hospitals, but some of the most important are northern Gaza and Khan Yunis, and many of those are really not functioning anymore. But focusing on Rafah right now, because that is where the incursion is occurring, and if it increases, these hospitals need to be able to function to provide basic care, particularly trauma, maternity, and other situations. They also have not had sufficient supplies, and we're talking really basic supplies such as analgesics, oxygen, medications, and so if fuel is not allowed to get in, as Dr. Tedros just mentioned, together with other goods that are life-saving, then more and more people will continue to die.
And according to UNICEF, there are more than 600,000 children currently in Rafah, and they're either injured, sick, malnourished, traumatized, or they're living with a disability. And when these children are asked what they wish for, the two most frequent responses that we hear are, "I wish I was dead," or "I want the war to end." Just talk to us a bit about what a Rafah invasion would mean for these children.
I mean, we often talk about with children, but in terms of the short-term effects and then the longer-term effects. And we have the physical effects that you were mentioning from lack of food. Already, some are malnourished, do not have sufficient, are not able to sufficiently address the infections that they are incurring. And because also in Rafah, we know with 1.2, 1.5 million people living in Rafah already under horrific conditions, the water and sanitation, the population density, diseases are very, very easy to spread. And diseases are often, particularly in malnourished children, more severe. But we also haven't really addressed yet, I mean, you were hinting at it, the mental health effects of these children and the whole population. But the mental health effects in the short term are quite serious. But for children, the longer term mental health effects can be quite severe and can last a lifetime. So there's just a tremendous amount of aspects that we need to think of, from the physical to the mental health to the disabilities in the long term.
Right. Due to the triangle of death, and you touched on it a bit, Palestinians are facing this triangle of death that includes epidemics, dehydration, and starvation. And the humanitarian catastrophe is only going to get much worse before it gets any better, surely only if Israel complies to international law. But just give us some insight into your projections on how a Rafah invasion and really the overall war will impact Palestinians in the enclave in the long run.
So a while back, we did projections over a 6-month period, and the worst case scenario were approximately 85,000 deaths over a 6-month period. Our projections still, or the amount of deaths being reported by the Ministry of Health, fit into the projections because, of course, we have an uncertainty. We're in the midst now of trying to look at some of the specifics of an invasion by the Israelis into Rafah. because the situation is different than it was many months ago, particularly because you have so many people now in Rafah. So looking at types of bombs that and the density of the population, we're trying to look at particularly the trauma deaths that may occur in that situation. But it's untenable at this point from a humanitarian perspective. And I may say that we're often, and we understandably right now are focusing on Gaza and particularly Rafah, but the humanitarian situation, we for us it's neutrality, humanity, impartiality, and independence. So we should also be mentioning, you mentioned the hostages as well. They're going through insufferable ordeals as well. And so from our point of view, a ceasefire and release of hostages and allowing all the aid and fuel and food that would need to get in is going to help civilians no matter where they live.
Right, and we did hear of the unfortunate death of one of those hostages due to an Israeli strike on the Strip. Doctor, thank you so much for being with us here on TRT World and sharing that insight with us. I appreciate it.
Thank you.